Good day, I am Casey Anikdaw of BSN 3 and today I am going to perform oxygen administration by nasal cannula. Nasal cannula or prongs, this is used for low-medium concentration of oxygen for about 24 to 44%. The purpose of this is to allow uninterrupted delivery of oxygen while the client ingests food or fluids. Next are the equipments needed for the procedure. Oxygen tank supply with humidifier and water, and of course flow meter. Next is the tape. This is for the proper placement of tubing. And then after that, the nasal cannula tubing with pedja size. And then after that is the gauze pad. This is to lessen skin breakdowns and no smoking sign for the safety purposes. Our goal is the patients exhibit an oxygen saturation level within acceptable parameters. For the assessment, observe for signs and symptoms associated with hypoxia, such as cyanosis, breathing pattern, chest movements, lung sounds, apprehension, and decreased level of consciousness. This is to check if the patient is suffering from hypoxia. Next is review patient's medical record for order of oxygen therapy. Note method of delivery, flow rate, and duration of oxygen. This is to follow the 5R of medications. This will serve as the baseline on oxygen administration. Mode of delivery, nasal cannula, flow rate, 3 liters per minute. After the assessment is the planning. First is assist the client to a semi-filar position if possible. This position permits easier chest breathing. The rationale for doing this position facilitates optimal lung expansion. After that is introduce self, verify the client's identity and explain the procedure. Introducing self will establish rapport. Verifying client's identity is a way to know if we are handling the right patient and explaining the procedure to patient and family what the procedure is. And the purpose of the oxygen therapy will give them idea on what we are going to do and what we are doing, as well as the reason why are we doing this procedure, and of course reviewing safety precaution necessary when oxygen in use. And then, place oxygen in use and no smoking sign in the entrance of the patient's room and overhead of the bed. This is to prevent fire because oxygen will make a fire burn hotter and faster. First, perform hand hygiene. This is to prevent gross contamination between the nurse and the patient. To make the clients comfortable, provide client privacy by closing curtains around bed and close the door in the room if possible. The last for the planning is obtain and place necessary equipment at the patient's bedside. The rationale for doing this is to easily access the equipments needed on the procedure. For the implementation, first is set up the oxygen equipment and humidifier, then attach the flow meter to the oxygen tank. Note that the flow meter should be in the off position. If needed, fill the humidifier bottle. Attach the humidifier to the base of the flow meter. Attach the prescribed oxygen tubing and delivery device to the humidifier. Next is turn on oxygen at the prescribed rate and ensure proper functioning by using the posterior aspect of the forearm to fill oxygen released from tubing. Prescribed rate is 3 liters per minute. Oxygen must be administered as prescribed. Next is place the prongs in patient's nostril. Place tubing over behind ear with adjuster comfortably under chin. If the cannula will not stay in place, tape it at the side of the face. Adjust the fit of the cannula as necessary. Tubing should be snug but not tight against skin. The rationale for doing this is proper placement in nurse ensure accurate administration. And then, pad the tubing over the ears and cheekbones as needed. This is to keep the skin from getting sore. Then last is encourage the patient to breathe through the nose with the mouth closed so that the patient consume the oxygen needed to sustain normal body functioning. Next is to assess patient's respiratory status, including respiratory rate, effort, lung sounds, note any signs of respiratory distress, such as tachypnea, nasal flaring, use of accessory muscles, and dyspnea. This is orientation to help the nurse evaluate effectiveness of therapy and detect clinical evidence and perform hand hygiene and put on gloves. Remove and clean the cannula and assess NIRS at least every 8 hours or according to agency recommendations. Check NIRS for evidence of irritation or bleeding. Rationale for doing this is to permit early detection of skin breakdown or inadequate flow rate. After that is the evaluation. Reassess the patient to determine the response to administration of oxygen by nasal cannula. This is for the patient's response on oxygen therapy or administration by nasal cannula is effective because respiratory status goes on normal status. Procedure is the documentation. Record on nurse notes at the beginning and end of the nursing shift and include the shift report of the following. Oxygen therapy through nasal cannula. Respiratory assessment findings. Before is 12 breaths per minute and after the therapy is 18 breaths per minute. Patient is cyanotic before. After the therapy, the patient is not cyanotic. Fast chest movement is observed and after the therapy, normal chest movement is observed. Method of delivery through nasal cannula with a flow rate of 3 liters per minute. Patient's response is good. There are no adverse effects, reaction, and side effects after the procedure. The importance of documentation is this will serve as a patient's record. That's all. Thank you.